Hello, it's the Fly-Foot Doctor. Welcome. This week we're going to be talking about pinched nerves. I'm going to break down what pinched nerves is, what causes it, what are some of the symptoms, and what are some of the things that you can do at home. And of course, if you can't do anything about it at home, what are some of the things that we as doctors can help you with? If you're new here, I'm the Fly-Foot Doctor. I'm a foot doctor and surgeon podiatrist practicing out here in Houston, Texas. If you would love to follow me and if you enjoyed this video, please follow me and click the link down below, and also follow me on my other platforms on Instagram as well as on TikTok. Now let's get into this topic. So we know what nerves are. They are the instrument with which the brain transfers instructions and communication from this big old skull all the way to the rest of our bodies. Now, when the nerves are going through, our necks, our shoulders, everywhere else, they oftentimes have to bob and weave and pass through different canals, different junctions, different body parts, organs, and things like that. Now, sometimes while they're going through their journey, something could happen where they're a little squeezed and they're just like choked and they're tight, or there's a little kink in the nerve or something, or they are pinched. So what are some of the things that could cause pinched nerves, and what are some of the most common pinched nerves that some patients may have? Now, it's important to note that a pinched nerve could also be called a nerve entrapment or compressed nerves. These are all different synonyms which essentially mean the same thing. The nerve is being choked and it is just so much pressure that's going on the nerve. Now, what is the most common cause of a pinched nerve? The most common cause is when you see a trauma. So something drops right on the nerve, or something drops right next to the nerves, causing swelling, which then pushes on the nerves. Or you fall and you hit right where the nerve is going through. Or you trip, you twist it, or you may be a broken bone that then pierces the nerves or pushes on the nerves long enough that it starts to cause issues. Now, we need to also understand that nerves have blood flow to them too. They have blood supply to them. And so if that blood supply is cut off by either swelling or trauma or injury, that could also exacerbate the nerve trauma, the nerve entrapment, the nerve compression, and the symptoms that this patient may be having. Another common cause is repetitive trauma. Now, patients that are doing things repetitively, like let's say you stand for a living, or you're in the military, or you're an athlete, repetitive motion and repetitive trauma can also cause a nerve entrapment or a pinched nerve. Now, especially in the foot and ankle, one of the most common things that we would see is tarsal tunnel syndrome. I'll break that down for you a little further in a minute. Tarsal tunnel is a little tunnel that we have in our ankle. It's very similar to carpal tunnel that we have in our wrists. In this tunnel, you have nerves, you have veins, you have arteries, and you have tendons. Now, a lot of the most common things that could cause tarsal tunnel syndrome, which really is compression of the nerve in that canal, is maybe there is a cyst in there. That cyst, again, could be pressing on the nerve. Remember, we've called it a nerve compression, a pinched nerve, or even a nerve entrapment. So a cyst in the tunnel could be pressing on it. Sometimes the retinaculum over that tunnel could also be causing pressure on the nerve. The nerve can't breathe. It has no wiggle room. It has no way to move and just let the adequate blood flow get to it. And so it starts to scream. It starts to holler at you. Hey, I'm getting pinched here. I'm getting compressed here. And you hear that as pain. Pain in that area. Another uncommonly common one is actually sometimes heel pain. Now, most heel pains are usually plantar fasciitis, but there are tons of different causes of heel pains as well. Now, one of the common causes that is sometimes overlooked is a nerve entrapment of the lateral or the medial calcaneal nerve. Now, this is a branch of the posterior tibial nerve that sometimes pierces through the retinaculum and dives down to the medial part of the foot. And what happens is patients have pain in that almost exact area of the medial plantar attachment site of the plantar fascia. So the symptoms are very, very similar to plantar fasciitis, and a lot of the times the patients also do have plantar fasciitis. However, what could be happening is that nerve is also trapped in there because of inflammation. So remember, there's swelling, there's compression. And so if the plantar fascia is inflamed and there's swelling and there's scar tissue and the nerve is traveling through that area, guess what? It's like it's coming into a stormy ground. There's fluid everywhere, there's trauma, there's inflammation. Now it's being compressed. So that is another thing with repetitive trauma that you could cause nerve compression, pinched nerve, or a nerve entrapment. Now, a bone spur. So remember when I said that nerves passes through these crevices, these different parts of the body? What could also happen is that through these crevices and different parts of the body, there could be bone spurs. These bone spurs could be pushing on the nerve. Now you have the bone beneath, you have the skin, and that is just causing constant pressure and constant compression. And so that's something that could also cause a pinched nerve or a nerve compression or an entrapment. So like I said, a ganglion cyst. A ganglion cyst is a fluid-filled cyst that's usually benign, comes from either the joints or the tendons, and that they're across or next to, on or beneath a nerve. They could oftentimes cause pain. Another thing could be a fibroma. A fibroma is a benign tumor of fibrous origin, and this fibrous origin are the same kinds of cells that make the plantar fascia, scar tissue, and things like that. If they happen to get big and they're pushing on the nerve, that could cause a nerve entrapment as well as a pinched nerve also. Now, shoes. If you're wearing a shoe and you're noticing that you bought these new pairs of shoes, you start tying them differently, or you start lacing them up differently, or it had the Velcro straps in a different way, and all of a sudden you're starting to have pain. Sometimes the shoes could be causing an entrapment or a pinched nerve because there's too much pressure, cutting off blood supply, pressing on the nerve, and causing issues. Sometimes it could be on the side of your foot, your heel, the top of your foot, anywhere that you have nerve, the shoes can also be affecting it. So look out for that one. Underlying conditions could also cause nerve entrapment by way of generalized inflammation. And what that looks like is in things like rheumatoid arthritis or diabetes, where there's inflammation in the body. Sometimes that could also cause inflammation that again causes swelling around the nerves that causes that pressure. So sometimes those are things that we have to look out for. And one of the things that does not directly correlate but ultimately does correlate is obesity. The bigger we are, the more pressure we're putting on the soft tissues all around the nerves, and sometimes those increased soft tissue all around the nerves can put pressure on the nerves and cause discomfort and pain. All right, so now we know what a pinched nerve is. What are some of the things that could be causing it? But what does that feel like? How would you know if you had a pinched nerve? Well, let me break it down to you. Sometimes you may feel like pins and needles. Oh, here's a good one. So, have you ever fallen asleep? Or maybe you're just on the loo and you're texting continuously because there's this great conversation you're having with your friend and you're done using the restroom, but you just don't get up, and then you go to stand and you're like, oh geez, I can't even stand because your legs fell asleep. That falling asleep is because you've been pinching the nerves in your legs. So you've been pinching the nerves in your legs, you've been causing the blood supply to the nerves to be reduced, and now it can't even pass information from the brain to the legs that says, stand up straight and support the body. It's not able to do that. Because it's not able to do that, you're tripping and you're not walking perfectly. Or you have been kind of, sleeping at your desk and putting your hand on your desk, and then you go to stand up and, ooh, you have that. You gotta hit it a little bit because it's like pins and needles and it's just numbness and tingling and shocks or things like that. Or you're walking around, in your house and you have you ever hit this nerve? I have before. I hit it before, and it's one of those things where you stand and you just literally contemplate the meaning of life, okay? You're just like, I literally felt this pain here everywhere in my body. Like, why? That is the most frustrating thing. Like, I literally, especially my ulnar nerve, when I hit it, it'll come all the way here because that's where it supplies, and whoof. So those are some of the symptoms. You have numbness, tingling, pins and needles, shooting pain, shocking pain, all of those things, muscle weakness, loss of control, loss of balance. So those are some of the symptoms. Now, a lot of the times if it's something acute, meaning it just happened shortly, you hit it or something dropped on it, it'll go away in a few minutes, maybe even in a few hours. However, if it's something that's pretty constant, like a bone spur, or, there's a cyst, or, continuous lack of pressure that's causing pinching of the nerves, that could actually last a much longer time. Sometimes a pinched nerve could also cause weakness in the legs or in the foot, And patients will have what we call drop foot. Patient is not able to walk and lift up their legs the way they're supposed to, and so they're having significant discomfort or pain, and when they're walking, they're not able to lift their foot, so they're lifting their thigh, and it's almost like on that foot they're mad, they're kind of marching and stepping up and raising their thigh. So sometimes drop foot could be a symptom of a pinched nerve or even nerve damage, but that's something someone like myself or neurologist will identify and help you solve. All right, so recap, we know what a pinched nerve is. We know what causes it. We know what the symptoms are. Well, what can you do at home? Now, if it's something acute where something fell on it or, something that happened, maybe your shoes, make sure you're wearing loose shoes. Make sure that you're looking to that you're not tightening your shoes excessively, because that could cause pressure in the area. Now, I love to wear high-heeled shoes, but one of my biggest secret is whenever I get to my destination, you better believe I'm taking those high heels off. Of course, except I'm dancing, and then you will see me in my heels, but I also always have a pair of flats, and that's because excessively wearing your high-heeled shoes could be causing pressure in your nerves, could be exacerbating a pinched nerve that you have. So if you found that you're having a pinched nerve, try to identify the cause of it, especially if it just came out of nowhere. If it's shoe gear, then modify it as necessary. I'm not one to tell you not to wear your high-heeled shoes because I love my high-heeled shoes, but we have to do it reasonably, okay? I love to wear them too, so I want you to enjoy them. So let's do it reasonably, all right? Sometimes this custom paddings that you would get could also actually help. You can pad the area if it's coming from a bone spur. Sometimes that could help, and if it's coming from a shoe, that could also help as well. You could get some of these over-the-counter paddings from, Walgreens, Walmart, or your local stores, wherever part of the world that you are. Now, if you've tried all of this and you're still not getting relief, it's still not getting better, that may be a time for you to see a doctor. Because sometimes if you're having numbness and tingling and pins and needles, there may be a bigger thing brewing at the back, so we want to make sure we check that out, okay? So if you're not getting resolution to your pain and discomfort, and you've modified your shoes, maybe something dropped and you've used ice, over-the-counter medications, and it still didn't help, then you probably want to see your doctor. Give it a few days to get better. If it hasn't gotten better, then give your doctor a call, okay? If you want to see me personally, you can reach out to us on our website or give us a call, 832-415-1790, and we'll get you booked and seen. Some of the things a foot doctor like myself will do is I'll do some tests to make sure if it's your nerve or other things that may be causing the pain and discomfort, like nerve conduction studies, an EMG to see how your muscles are working, the messages that are being sent from the brain getting to the destination that they need to get to. Ultrasound sometimes may be something that we'll do, and we will just check you out, do x-rays as needed if it's a spur that's pushing on it, and sometimes this could help. I'll tell you a little story. I had a patient come to me once, and this patient happened to not see his own doctor anymore because I think the doctor was out of town or something. I don't remember what happened. But point is, he was seeing this doctor, he was planning for surgery, and he was gonna do surgery. But something happened, and then he came to see me. And so we started to evaluate this patient, and it was a nerve at the top of his foot that was really, really hurting. And this was the dorsal-cutaneous nerve, one of the dorsal-cutaneous nerves. And so after evaluating him, I said, all right, you know what? There's something going on here. It seems there's an inflammation around this area. So we said, how about this? Let us try a steroid shot around the nerve, calm the inflammation down, and let's see if that helps it, because I think they were gonna do a nerve release or something. I don't remember the details. But we were able to help him and avoid surgery. Look, I love surgery. I love to do surgery just as the next surgeon and podiatrist likes to do surgery. However, I also understand that it is not the first line of action. There are tons of conservative treatment options that we will give you to make sure that you get better before putting a knife to you, okay? So best believe, if you're coming to see me, I will exhaust all conservative options first before we talk about releases of the nerves. One of the things that could be done if we've done all these tests is a nerve release. And the nerve release essentially is removing all the tissues, the entrapments and things that could be compressing the nerve, pinching the nerve, or causing it to lack blood flow. So those are one of the procedures that we could do as a last resort typically to help you get relief if we've tried and exhausted everything. All right, we've talked about all of this. Could you tell me down below if you've had this symptom, what do you think, based on what we've talked about today, is the most common cause that you may be having that may be causing your nerve entrapment? Leave a comment down below. I would really, really like to see it. And If you definitely have had the symptom where you sat on the toilet a little bit too long, just leave a comment down below and say me too, because I know I've had it before. Thank you so much for watching till the end. I really appreciate it. It's the Fly for Doctor. You can follow me right here on YouTube. If you enjoyed this video, please would you kindly hit the subscribe button and follow our family. I really love it. Also hit the like button here and share this video. It helps the YouTube algorithm share this with other people that may be having symptoms and hopefully help them with what they're going through as well. Also, you can follow me on Instagram or on TikTok. It's the same name, The Fly for Doctor. Till next time, I'll see you later. Hasta la vista.